It's our last few lectures for this semester. This one on the back problems and fractures I just put together. There's not much to cover in here. Your nonsteroidals, some opioids, antispasmodics, epidurals, injections of some steroids. I'm going to cover briefly on some analgesics for the pain, the anticoagulants, but not antibiotics. Hopefully you can see this slide okay. Just gives you the non-selective and selective nonsteroidals. Remember, there's the COX-1 and the COX-2. COX-2 only are considered selective. The only one on the, you see the Selexazib or Celebrex, Meloxicam or Mobic. The others are all the combination COX-1 and COX-2, which has a higher GI risk and bleeding risk. The ibuprofen, naproxen, diclofenac. Don't worry about the last one, just those three. And remember, the diclofenac comes in a patch and a gel form plus a pill. And then what's not on here is your ketorolac or your Toradol, which comes in a pill, IM and IV. You can look information in your Pearson, page 898, and in your Karch textbook, chapter 16, table 16.2. Talks a little about your nonsteroidals. They have an analgesic, antipyretic, which is fever, and an antiplatelet effect. Oh, also add your nonsteroidal. COX-1 and 2 is your aspirin, should be on that list. Some of these, don't worry about which ones, but you can also find these nonsteroidal anti-inflammatories in ophthalmic or eye solutions or to take down inflammation and to help with pain, and sometimes it can help with fever. So I found this mnemonic, which I thought might help some for your contraindications for NSAID on the side, nursing and pregnancy, serious bleeding, allergy, asthma, angioedema, impaired renal function, or if they're on an anticoagulant. Not mentioned here is also the nonsteroidals are often contraindicated in hypertension, or they can increase your blood pressure. And just briefly on your muscle relaxers, these are the ones I want you to focus on: your cyclobenzaprine, tizendine, baclofen, methocarbamol. I will test you on your generic name. I might give generic and brand name, or I might just give generic name. I put the brand names on here to help you be familiar for functioning in the clinical setting. And I made notes for you too, because the cyclobenzaprine and tizendine are both oral only. Baclofen is oral, or it can be injected into the spine. Methocarbamol, Robaxin, can be oral, IV, or IM. You can find more information in your Karch, chapter 25. Remember, it works in the central nervous system, so there's caution if they have epilepsy, any cardiac dysfunction, hepatic or renal dysfunction. With pregnancy or lactation, they have to weigh risk and benefit to decide if they're going to use them. Adverse effects or side effects are your central nervous system depression, which can be expressed as drowsiness, fatigue, confusion, headache, insomnia, some GI issues or nausea, dry mouth, constipation. They might have hypotension and arrhythmias. Analgesics, I thought this was a kind of cute picture. There's information in your Karch textbook, chapter 26, table 26.1. Just remembering your pain medicines. I thought this was good, where it has your oxycodone, two in that class, or 3 in that class, are your Percodan, Percocet, and Oxycontin, used for your strong pain or significant pain, moderate to severe pain, and has a little picture on the side here for your pain meter, like a 9 to 10. Percodan, Percocet. Don't see Percodan really prescribed much, but your Percodan and Percocet, you can remember. It's not going to let me put my mouse back on. Percodan has an A in it because it has aspirin. Percocet, the C T is because it has acetaminophen or ibuprofen in it. So this has acetaminophen. Percodan has aspirin. Oxycontin is an oral form of morphine. These are all your oxycodones. Then for moderate pain, you have your hydrocodones, which the common brand names are Lortab, Vicodin, and Vicaprofen. Another one you see a lot now is Norco prescribed. These are all hydrocodone. A lot of times when you see hydrocodone or prescription, such as Lortab, it'll be hydrocodone acetaminophen. There is, I can't think of the name right now, because there's one that has, can't think of the name. There's one that has ibuprofen in it rather than acetaminophen. The rest of them, the Lortab, the Vicodin, Vicaprofen. That's the one. Shoot. Vicaprofen has ibuprofen, Vicodin, Lortab have acetaminophen. There's another name I can't think of. But the profen on the end, know that has ibuprofen, not acetaminophen. One of your teaching things with your patients is always knowing, like the Lortab will have 325 milligrams of acetaminophen, or that's one regular dose Tylenol in it. So you don't want them taking a whole pile of Tylenol plus taking the Lortab to get acetaminophen toxicity. Same thing with your ibuprofens. If they're on something like a Vicaprofen that has ibuprofen in it, you want to find out if they're taking any other nonsteroidals or if they're on anticoagulants, high blood pressure, contraindication for a nonsteroidal. Your lowest, your intermediate for your opioid pains, and it has mild to moderate pain is usually your codeines. One of your examples is your Tylenol with codeine, or Tylenol 3 is what you might see it written as. So you just, addiction, GI upset, central nervous system depression. Oh, I forgot, I have a slide here. I found another picture I thought was really good for your major opioid adverse effects. I think you can study this for your effects, the mood changes with dysphoria, euphoria. I'm not going to read the whole slide to you. I thought this is a really good slide for you for your teaching and watching your patients and understanding opioid. And that's all you really need to know on these. Just a little information on anesthetics. There's tons in your text. It goes way too much in detail. They can be given, I put them here, your local benzocaine, spinal is tetracaine, lidocaine, epidural or local or lidocaine, and bupivacaine. If you notice the cane ending on all of them, your local benzocaine usually kicks in a lot faster, spinal will last a lot longer. Contraindications, or if a person has an allergy to the canes, or if they have a history of heart block, because this can aggravate a heart block. Caution in pregnancy and lactation, and if they have any impaired liver function, because if any of this is absorbed systemically, there is a chance of that, and they cannot excrete it in the liver, so there's caution with the dosing. Adverse effects, some of the central nervous system effects, just think of it being your central nervous system. Restless, headache, anxiety, blurred vision or tremors. Your GI effects, nausea and vomiting. Cardiovascular or peripheral vasodilation. So if you think of the periphery, like your ankles dilating, there's a chance of having peripheral edema. Arrhythmias, blood pressure changes, whether it be high or low, and myocardial depression. Some other adverse effects, especially if it's given as a local burning sensation, swelling and tenderness at the site, and some anticholinergic type of, anticholinergic, cholinergic effects like urinary incontinence, also may have some pruritus, which is itching, and there's a risk of seizures. Last thing in this section is your anticoagulants that can be used if somebody has a fractured hip, fractured something, and they're immobilized, their risk for clots, they will give an anticoagulant. Your CARCH chapter 48 has table 48.1, goes over some information. Contraindications are listed on page 838 of CARCH. I gave the common ones, Paxaban, which brand name is Eliquis, heparin, that is the generic, there's not another name for it, Rivaroxaban, warfarin, enoxaparin. Now, Paxaban and Rivaroxaban, can't even say them, are the newer ones. You don't have to do any coagulation studies for that. Of course, your heparin, you're monitoring your PTT, partial prothrombin time. Your warfarin, you're monitoring your PT-INR prothrombin time and your ratio. Enoxaparin is subcutaneously, and you're not doing any monitoring on that. If there is an anticoagulant needed during lactation, the preference is heparin. Any anticoagulant, there's caution if they have heart failure or a history of psychosis. And obviously the common adverse effects are bleeding. And it pretty much covers what you need to know for this. And that's the end of this recording.